Tell me you're a urogynecologist without telling me you're a urogynecologist. Ta-ta-ta-ta-ta, Pessaries! But wait, what is a pessary? Well, a pessary is something that can change the lives of many women in my world, but we don't talk about this nearly as enough. But today we're going to change all that because we're going to learn all about pessaries. Hi everyone, Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. If you're new to the channel, welcome. Here we talk about everything pelvic health, so if you like what you see, don't forget to subscribe and share it with a friend. So let's start with what is a pessary. So a pessary is a vaginal insert. It's made up of silicone, so you can see it's soft, that can be folded very easily. And the idea is that we put it inside the vagina to help support your pelvic organs, which could be the uterus, the bladder, the urethra. So there are many conditions that we can treat with pessaries. Things like pelvic organ prolapse or stress urinary incontinence. So imagine this, you recently gave birth to a child or you're going through menopause and you suddenly notice that it feels heavy down there. You feel this sensation that there's a bulge or that there's something hanging out from the vagina. Or anytime you're laughing, coughing, sneezing, or exercising, you notice that you're leaking urine. So the first one where you feel that bulge is known as pelvic organ prolapse, and that leakage with laughing, coughing, any kind of physical exertion is known as stress urinary incontinence. And both these conditions can be treated non-surgically with the use of a pessary. Now, I have many previous videos that talks in details about pelvic organ prolapse, stress urinary incontinence. I will add the link to some of those videos below, so definitely check it out. But today we'll be focusing primarily on pessaries and how we can use them. A lot of the times when patients come to see me, they think that the only solution to things like pelvic organ prolapse or urinary incontinence is surgery. But that's far from the truth. A pessary can be a great non-surgical, non-invasive, reversible, as well as a very effective treatment solution for helping patients who are suffering with these conditions. But how does it work? So as mentioned, pessary is a vaginal insert. So we actually have to insert it into the vagina where it can help support your pelvic organs. They come in different shapes and sizes, and I'll show you examples of a few common ones. So there's some pessaries that we use for prolapse, and then there's some pessaries that we use for patients who are suffering with urinary incontinence. So the most common kind of pessary is probably this right here. We call it ring with support because it has this little ring, right? This donut, and then you have this support. So this is one size. This is probably one of the most common sizes we use, which is a size 3. But as you can see, we also have a ring pessary, which can be much bigger, right? Similarly, we have this pessary right here, which looks like a little cube, and that's what it is. It's a cube pessary. Then there's this little pessary right here, which essentially looks like a little baby pacifier. It has a little dish and then a little stem. This is known as Gellhorn pessary. And then there are some other pessaries that we use to help with patients who have urinary leakage or stress urinary incontinence. So this pessary right here, as you can see, it has a little ring and the support, but it also has a little knob which helps push against the urethra and can help women suffering with leakage. There's also the incontinence dish. So again, this is a specific one that we use for patients who are suffering with incontinence. And all the pessaries that I showed you can come in different shapes and can come in different sizes. So for example, the ring pessary, I showed you that there can be a smaller size and then there's a large size and there's a lot of variation in between. Similarly, like, a Gellhorn pessary can be, a small size and then a large size, and there's a wide variation in it as well. So when I have a patient who comes in for a pessary fitting visit, I first start with doing a thorough physical exam, specifically a pelvic exam. Because fitting somebody with a pessary is like fitting somebody with a dress. You try different shapes and sizes based on their vaginal caliber. So it's really important for us as a specialist to understand what size will be appropriate for the patient. Because if the pessary is fitted right, then the patient shouldn't really feel uncomfortable. They will feel that something is in there, but they should be able to go about their everyday life. It's kind of like, having a tampon inserted. So a few of the measurements that we do, the first thing we measure is something called the genital hiatus, or essentially the vaginal width, because that gives us an idea like what should be the diameter of the pessary that we should use. Because if somebody has a very narrow vaginal opening, then we want a smaller size. Whereas if somebody has a very wide vaginal opening, which can happen, especially when patients have prolapse and there's a lot of vaginal laxity, we want to go with a bigger size. The trick to fitting a pessary is you want it to be big enough so that it takes care of the problem, but not so big that it rubs against the vaginal walls and then causes patients discomfort. So finding the right size can really play an important role in how well the patients will tolerate the pessary. Once I do some basic measurements and have an idea what size I think would be appropriate for the patient, I start with the most common one, which is the ring pessary with the support. This is very easy to insert. Patients tolerate it very well. As you can see, it's pretty soft and you can actually almost fold it like a little taco, which can be really helpful when you're trying to insert it. So the idea is when we're inserting it into the patient's vaginal canal, so imagine this is the vaginal canal, I usually fold the pessary in half. I put a little bit of lubrication to allow for easy insertion. You put it inside the vagina and you kind of push the whole thing in till it's inside the vagina, and make sure you actually push it back so it's behind the pubic bone. So this is the pubic bone, which is the top bone, that hard bone on our abdomen. So I want to make sure that the pessary goes beyond the pubic bone, because otherwise, if it stays right at the vaginal opening, it can be really uncomfortable for the patient. Once it's pushed in, I usually have the patients, bear down to make sure the pessary is not moving out and that it's still staying in place. Afterwards, I usually have the patients walk around the room, do a few lunges and squats, basically trying to see if the pessary still stays in. Because if she squats and the pessary comes out, or with any kind of Valsalva and exertion, the pessary comes out, then we need to upsize it and go to a larger size. At the same time, if the patient is uncomfortable with the size that we put in, then we may have to downgrade and go to a smaller size to make it more comfortable for her. Once we have fitted them perfectly and the patient likes it, the pessary is stayed, the patient usually goes home. I usually have the patients follow up again with us in about 2 weeks to see how they're doing with the pessary. If patients are happy with their pessary, then we're good to go. Or the concerns or the pessary came out when they were home, then we try to change the sizes appropriately. Now, as I mentioned, this is the most common type of pessary we use, which is a ring pessary with support. If this doesn't work for one particular patient, we can use some other shapes. So for example, this is another common one that we use, the Gellhorn pessary. So this is more for patients with advanced prolapse, because again, when we put it in, it kind of acts as a barrier, but it also has a little bit of a suction onto the patient's tissue, and that can help with preventing prolapse as well. Now with the incontinence pessaries, usually they have a little knob. So when we put it into the vaginal canal, the knob is laying against the urethra, so it can kind of provide the support for the urethra, so that can help with leakage of urine. For the pessary to be effective, it has to stay in the vagina all the time. So I have many patients who manage their pessary themselves, and what that means is they take it out every other day, or while they're in the shower, they wash it and then reinsert it. We do recommend removing the pessary with intercourse, or for my younger patients, during their menstruation, they usually prefer to remove it so that they can use a tampon. I have many patients who don't like to manage the pessaries themselves, so we usually have them come to our office every 3 to 6 months, and we take it out, clean it, and then reinsert it. A few important tips to consider is sometimes, especially for my postmenopausal patients, if their vaginal tissue is very dry, which can happen when women go through menopause and there's a lack of estrogen in their vaginal tissue, it can make the vaginal tissue very dry, very irritated. And so when the pessary rubs against that dry vaginal wall, it can cause some irritation and bleeding. So for a lot of those patients, I actually prefer to start them on some vaginal estrogen cream, because it helps improve the texture of the tissue as well as act as a lubrication to help prevent some trauma from the pessary. It's very important to remember that pessaries should be taken out periodically and cleaned and reinserted. And the reason for that is if you put it in and don't take it out for months or years, then that constant pressure onto the vaginal walls can cause ulceration to the vaginal walls. And in rare situations, it can cause enough trauma that patients may develop a fistula, which is a false tract, either between the vagina and the bladder or the vagina and the rectum. That's why it's so important that when you have a pessary, you follow up with your doctors regularly to make sure there's no concerns. Let's take a few minutes to talk about a few myths that I hear about pessaries. Myth number 1, a pessary is only for older women. Not true. Women of all ages who are suffering with pelvic organ prolapse or stress urinary incontinence who don't want to undergo surgery, this can be a great non-surgical treatment options for them. There's no right or wrong age to have a pessary replacement. Usually when I see patients in my office and I've counseled patients about different treatment options, this is definitely one of the options we talk about. And in fact, I have many young women who maybe are not done with children and don't want anything surgical till they're done with childbearing, consider pessary to help with some of the symptoms. Myth number 2, a pessary is super uncomfortable. Again, false. If placed right, a pessary should not be painful. It's kind of like a tampon. You know something is there, but it's not painful on a regular basis. Now, if it is painful, then it's important to understand why is it painful. Is it because it's not the right size? Maybe it's a little too big. Do you have a lot of vaginal atrophy? Remember, we talked about the vaginal wall thinning. Do you need some vaginal estrogen to help with that? Maybe you need a different kind of pessaries. There are lots of reasons why it could be painful, and those are important things to discuss with your physician. Now, why is it important to talk about pessaries? A lot of the times when I talk to my patients about incontinence or talking about pelvic organ prolapse, they have the assumption that, they need some complicated treatments to help with their symptoms, or they need surgery. And if they don't want to go through surgery, they think there's no other treatment options for them. And that is not true. As we discussed, the pessary can be a great alternative for the right patient. So why is it important to talk about pessaries? The thing is, there are thousands, if not millions of women, not just in the United States, all across the world, who are suffering with conditions such as pelvic organ prolapse and incontinence. They may not talk about it because they're embarrassed, they don't know what the treatment options are. Maybe they've been told that this is a normal part of aging, or it happens very commonly after childbirth, and women suffer in silence. Just because somebody doesn't want surgery doesn't mean they have to suffer with these conditions. There are lots of amazing non-surgical treatment options, and a pessary for the right patient can be a total game changer. So if you're somebody who's suffering with either pelvic organ prolapse or stress urinary incontinence, don't suffer any longer. Talk to your doctor. Ask them if a pessary can be an option for you. And if they're not familiar with the pessary, have them refer you to a urogynecologist so we can talk to you about the different options. We can do a good pelvic exam, try to find a pessary that works with your body type and get you fitted. Hope you found this video helpful, and if you haven't already, don't forget to subscribe. And for more helpful tips about your pelvic health, you can also sign up for my newsletter. The link will be down below. Talk to you soon. Bye.